Welcome back to the Traders Network. I'm Michael Yorba, your host, broadcasting to you live on 1190 AM iHeart Media and worldwide through yorbamedia.com. All right, I'm joined on the show right now with Edward Shin, CEO and co-founder of Quality Reviews, Inc. And, Edward, I was looking at your bio. Boy, you have really knocked it out of the park with some history of some very, very award-winning accomplishments in your past. Welcome to the show. Thank you for being here.
Thank you, Michael, for having me. That's very kind of you to say it so.
Well, please let our audience know just a little bit about the leadership skills that you bring to the table. They're immense. Not to fawn over you so much, but I mean we should at least hear some of the accomplishments you've had, and then if we could get into the company.
Sure. Again, very kind of you. Thanks for having me on the show. I appreciate it. So I'm actually trained as a physician. So I just have the privilege of spending a lot of money and a lot of time going to school. So, I attended the University of Pennsylvania School of Medicine, and came up to New York to do my residency at Columbia Presbyterian. But after all that hard work and schooling, decided that I wanted to be an entrepreneur, and this was during the late '90s. When the first iteration of the internet boom was well underway, and I wanted to be part of it. So when I finished my residency, I promptly got a job at a startup here in New York called Healthology, which was actually a health media startup at that time, a little bit ahead of its time, but a great experience, a wonderful experience that I did for a year. And I really caught the entrepreneurial bug at that point. So I decided to permanently leave clinical medicine, and we got another great position at a company called Gerson Lerman Group, an expert network based here in New York City, and proceeded to work there for the next 7 years, from 2001 to 2008, where I managed the healthcare practice for the majority of that time. And that was a tremendous learning experience. What a phenomenal ride in terms of company growth, and also personal growth for me, in terms of learning how to manage people and getting my business chops in order. So in 2008, I decided to leave and go out on my own. And with a colleague of mine, co-founded a company called Hilogica, which at that time helped match patients with clinical research studies, kind of a Match.com, if you will, of clinical research studies. And we had built an online matching tool for patients to find clinical trials that they would qualify for and make that match. We ended up selling that business in 2010 to the Michael J. Fox Foundation here in New York. So their Parkinson's research website is actually using the technology that we had built. And then in 2010, I met a gentleman by the name of Brett Shamish, and together we co-founded a mobile health company called Well Apps, and that company helped people with chronic illnesses manage and track their disease via smartphone applications. And we had a great app called GI Monitor, which helped people with Crohn's disease and ulcerative colitis really get a handle on their disease by managing their symptoms and helping them adhere to their treatment regimen. And again, we ended up selling that business in 2012 to another company called Medivo here in New York. So, serial entrepreneur, and now I'm working on Quality Reviews.
Tell us about it.
So Quality Reviews is a company, based here in New York, founded 2 years ago. And our flagship product, called Rate My Hospital, helps hospitals and other healthcare providers collect and manage real-time patient feedback via mobile devices. And there's a real need for this type of tool in the hospital space. With the advent of the Affordable Care Act, Obamacare, if you will, hospitals are now being incentivized to actually pay attention to and improve what they call the patient experience. So it's essentially what we're all used to in the non-healthcare world of consumer satisfaction, and they call it patient experience or patient satisfaction. And the government now has incentives, financial incentives, for hospitals to pay attention and improve the patient experience. But there are no good tools out there right now to measure what patient experience really is. In fact, the state of the art that exists today is really a paper-based survey. And I don't know about you, but I can't remember the last time I opened up the mail and filled out a 40-question survey, put it back in the mailbox. It's just not happening in this day and age. However, with the advent of mobile devices, there are statistics out there that say that 90% of us have cell phones and nearly 60% of us own smartphones. And with that in mind, it really presents an opportunity for a better solution. So that's where we come in with Rate My Hospital.
Tell us how it works. I mean, I've long been a proponent of first thinking tablets should be in the waiting room so that you can just fill it out, send it, and then it goes through all of the systems and everybody can access it. But tell us how your system works.
Sure, yes. So it is based on smartphone technology, and the unique thing about hospitals is they all have these patient registration systems, and they send us something called an ADT feed, or an admissions, discharge, and transfer data feed. Suffice it to say, it includes data like the patient's name, their cell phone number, their date of birth, who their doctor is, and when they were seen and why they were seen. So we're getting all that information transferred to us from the hospital. It's all secure, completely encrypted, so that whenever a patient leaves the hospital or checks out of an outpatient practice, we, through Rate My Hospital, will text that patient an SMS text to a secure link to a patient satisfaction survey that they take right on their smartphone. There's no app to download. It's all done through the browser. And the survey is really based on consumer-friendly 5-star rating scale that all of us are really used to filling out. And it takes much less than a minute to fill out. Certainly a lot less than that 40-question paper survey that we all get in the mail these days. Now, so that's really what the patient sees. It's done literally after the patient is seen or is discharged from the hospital. So it's real time. And all of that information is aggregated and displayed on an analytics dashboard on the internet so that the hospital administrators as well as the physicians can log in and see this real-time patient feedback coming in, and most importantly, act on it in real time. So, for example, if patients are telling the hospital, hey, look, your waiting area is dirty, yet administration can see that data coming in real time so that they can dispatch a housekeeping staff to the waiting area, clean it up so that the experience is improved for the subsequent patients that day rather than weeks or months from now, which is really the time frame that we're looking at for paper survey responses. So it's a really seamless, very simple process. We purposely made it very simple because it's very notorious to be able to, quote-unquote, integrate with hospital systems. So we purposely made it very, very simple for us to access that data and then transmit a secure message to the patient. So, based on the comment that you just made about tablets, I agree with you. I think tablets should be in each waiting room. The only problem with that is that tablets have a tendency to walk away when no one's looking. And we all know that, again, 90% of us have mobile devices, and we all live on our smartphones. I take the subway every day in New York City, and everyone is looking down at a 45-degree angle to this shiny screen on the subway, and it is remarkable to see that. So with the ubiquity of mobile devices and smartphones, this is a perfect technology that's seamless, lightweight, and very compelling for the patient. So that when you compare our response rates with paper survey response rates, I mean, we're literally getting 5 to 6 times more responses in a fraction of the time at a fraction of the cost.
You're way ahead of the curve, and I can see one of the things that you would have with using people's own cell phones instead of a tablet is nobody has to worry about touching somebody else's tablet that's been there before. And yes, nobody's going to walk away with somebody else's cell phone at this point.
Right.
You're way ahead of the curve. But all right, let's take a break right now. But before we do, please, you've raised a lot of questions in the content that you brought to the table. How can our audience reach out to you to find out more of some of the topics you brought up today?
Sure. Well, first of all, they can visit our website at ratemyhospital.com. And there's information there on how to contact us. If you want to email me directly, my email address is ed@q-reviews.com. That's Q as in quality, REVIEWS.com.
All right, and your Twitter handle, @RateMyHospital?
That's correct, yes.
All right. Ed, let's come back on the other side of this break and drill down a little bit more into your company, all right?
Great. Thank you very much.
All right. My pleasure. We'll be right back on the other side of this break with Edward Shin, CEO, co-founder, Quality Reviews, RateMyHospital.com. We'll be right back.
I'm Dr. James, founder of Diamond Physicians, a concierge medicine practice located in Dallas, Texas. Our Diamond 360 Advanced Physical Exam has been created for people like you who live a high-stress, fast-paced life. Every 40 seconds, someone in the U.S. experiences a life-changing heart attack or debilitating stroke. Negative stress tests and normal cholesterol levels do not exclude you. Half of all fatal heart attacks occur without warning. Diamond goes beyond traditional medicine with the Diamond 360 Advanced Physical Exam, proven to prevent heart attacks, strokes, and diabetes. Contact Diamond now at 214-395-3491. That's 214-395-3491. Or visit our website at diamondphysicians.com to take the Diamond Challenge. If your Diamond 360 reveals perfect health, receive a full refund. Your loved ones will thank you.
Are you keeping pace with the change in business development technology? Make the job of your sales team easier and lower cost. The world is moving to mobile apps. Digital publishing is the way of the future. For less than $90 a month, Cookie can create a professional mobile app for your company. If you don't have one now, you'll be left behind. Make marketing more powerful, more successful. Big results don't need big production and big costs anymore. Contact Cookie.com now. Cookie is the solution for you to create content live, easily, and fast to your own mobile applications. Cookie.com, KOOKE.com.
This holiday season, give the most eternal, unique gift of the year. Name a star after someone. I'm Rocky Moselle with International Star Registry. For $54 and a call to 800-282-3333 or visit starregistry.com, we'll name a star after anyone on your gift list. The star name will be recorded in book form in the U.S. Copyright Office, and we will send an incredible personalized gift package. Call the Star Registry, 800-282-3333 or visit starregistry.com for the gift that shines forever.
This is the sound of skiers in the backcountry. And these are hikers out on a trail with their new gear from REI. Oh, wow. At REI, we know you love the outdoors. And here's something else you'll love. Great deals on outdoor gifts for the holidays. Save up to 30% on selected items each week, now through December 17th. Shop your local REI or go to rei.com.
The mall sure is busy today. Okay, what's on my list? Birthday present for Beth, stop at the electronics store, and then grab a quick bite. Did that guy leave his shopping bag? Looks like there's a package inside, covered in duct tape. Did he leave it on purpose? That can't be right. Excuse me, security? I just noticed that there's a shopping bag.
We all play a role in keeping our communities safe. If you see something suspicious, say something to local authorities. If you see something, say something is used with permission by the New York MTA.
Welcome back to the Traders Network. I'm Michael Yorba, your host, broadcasting to you live from the Dallas KFXR 1190 AM iHeart Media Studios, worldwide through yorbamedia.com. All right, I'm joined on the show with one heck of an entrepreneur, way ahead of the curve on the technology front in the medical field, which that's saying a lot. Edward Shin, CEO, co-founder, Quality Reviews, ratemyhospital.com, the web address. Edward, welcome back to the show. I think we need to turn Edward up a little bit. There we go. All right, we got him going. Edward,
Great.
Thanks. Welcome back.
Thanks, Michael. Thanks.
My pleasure. All right, I've been looking all over your website over the break, and it seems that what you've been able to do, obviously you've got a track record of some very successful ventures, but you've been able to reduce the response time, increase the rate of response from the patients, and I left the last one for you. This amounts to tremendous savings, let alone higher morale about being in a medical situation and giving some feedback. Talk to me about the money side on this. How do you help?
Yeah, absolutely. So I'm glad you asked that. So we actually have taken some client data and did some comparisons, and this is some information on one of our clients, which is a large outpatient cancer center based here in New York. And this is just for the month of September to give you a flavor for the types of comparison that we have initiated between Rate My Hospital and paper surveys as an example. So in the month of September, we were able to deliver 300 completed surveys via Rate My Hospital, whereas on the paper side, they had 70 responses. Our median response time was 54 minutes, whereas on the paper side, the average median response time was 4 weeks. And we were able to do that at 1/17th the cost of a paper survey per response. So, in other words, we were able to deliver 5 times more survey responses, 800 times faster at a sliver. I mean, literally 1/17th the cost of a paper survey.
And reduce your carbon footprint and save a tree.
Exactly. That's exactly right.
Wow. All right.
So really, there's no comparison in terms of the data quality. I mean, the numbers really speak for themselves.
You are way ahead of the curve on this. You make me proud to have you on the show. Not only that, but you're really helping people in a humanitarian way, not just making money for other people or yourself. Let's talk about the milestones that you've achieved so far and what you have planned going forward.
Yeah, so we're a young company, a startup, 2 years old, and we have 3 great paying clients. Way past the pilot or beta stage. And we've been generating revenue. We're not profitable yet, but have been generating considerable amounts of revenue this year alone in our second full year of operations. The goals and milestones that we have outlined for the next 6 to 12 months are really to, number one, continue our sales process, and we have an open and active search for a sales director and a VP of sales who has tremendous amount of experience selling into hospitals. And related to that is in the first to second quarter of 2015, we are going out and doing a Series A fundraise so that we can support our sales and marketing efforts. In addition to help our development and product team get some more resources, i.e. more software engineers, so that we can support the scale that will inevitably come with more sales activity. Despite the fact that we have, quote unquote, only 3 clients, we do have one of the largest academic medical centers, and that's Mount Sinai Health System, and they're a 7-hospital system, and so despite the fact that we consider them one client, it's really 7 distinct hospitals where we're embedded throughout the emergency departments, inpatient and outpatient. So we want to ride this momentum that we've achieved over the last 12 months into 2015 with increased sales activity, convert some of our pilots that are underway, both here in New York as well as in the Midwest, and again, ride that momentum into a strong Series A raise.
Now, I can see that right now, all three of these, although the Newark Beth Israel Medical Center is one of them, Lutheran Family Health Center is another one, but this company that you have put together with your team, I can see that this is absolutely a global answer to a global problem. Are you getting requests for your business from outside the borders of the United States yet?
Yes, absolutely. So, we recently had some conversations with senior executives based in Asia, and I think that, ironically, outside of the United States, which, in many ways is considered a leader in technology, when it comes to broadband and when it comes to 3G, 4G LTE, and the ubiquity of mobile devices, the United States often lags in places like Europe and Asia. So, in fact, it makes perfect sense for a tool like this to be deployed throughout Asia and Europe and the Middle East. And we've actually had incoming inquiries from the Middle East where they're building really state-of-the-art hospitals, and they want state-of-the-art technology to be able to power not only the clinical side of care, but the healthcare services side. And things like Rate My Hospital is piquing a lot of interest from the Middle East as well as from Asia.
I'm looking at the homepage of your website, and you've got a picture of a laptop that's up, and it's showing us all kinds of analytics. So it's not just a text response, but it seems to me that you've got a database that is compiled that somebody can actually use beyond just check the box here. Talk to me about that for a second.
Yeah, absolutely, and I'm glad that you brought that up. So we're more than just a quote unquote survey tool. We're really a performance improvement platform. And as you noted on our website, that's really the homepage of the analytics dashboard that we make available to our hospital clients. It's all done on the web, so they don't need to install any new software. They simply log in with their credentials, and they can see the data that are coming in real time. But as you said, they can do analytics so that they can filter the data by date, by age, gender, who the doctor was, when they were seen, and also by score. So if an administrator only wants to see the low scores, they can do so. So as an administrator, you're seeing the data, you're filtering, so you can do real-time, for example, month-over-month or quarter-over-quarter or year-over-year comparisons. And it's all done in real time. Again, paper does not have that capability. Further to that, we have started to see interesting behavior of our clients who are actually using this tool as a CRM tool, what I like to call PRM, or Patient Relationship Management Tool. The administrators and the clinicians at these outpatient clinics as well as inpatient hospitals are documenting any interventions or service recovery improvements that they have made on our tool. So, for example, if a patient was upset by the exceedingly long wait time, which is all too often common here in New York, we're seeing administrators pick up the phone, give that patient a call, address their feedback, and make a note saying, hey, the patient really appreciated the fact that I called them back, everything's good, and they'll document it.
All right.
So what's really exciting is that this is more than, as you said, a survey platform, but it's becoming what I like to call a PRM tool.
That is amazing. We're about out of time. Before we go, please, contact information. You have solved the riddle. This, as far as I'm concerned, when it comes to what you're doing, you got the silver bullet. How do we reach you?
Yes, so our website URL is ratemyhospital.com, and you can always email me at ed@q-reviews.com. That's Q as in quality, reviewers.com.
Really a ground floor opportunity. One last thing before you hang up, please. Is there any live events that our audience can go to shake your hand and talk to you?
Yes. So we will be exhibiting Monday and Tuesday, December 8th and 9th at the Gaylord National in National Harbor, Maryland, where we'll be attending the mHealth Summit. And then again in Dallas, Texas, in your neck of the woods, we'll be at a conference called the Hospital Value-Based Summit in January, on January 28th through the 30th of 2015.
Edward, thank you so much for being on the show.
Thank you, Michael. Take care.
My pleasure. Edward Shin, CEO and co-founder, Quality Reviews. Special thanks to 1-800-PublicRelations.com for all their PR and media support. Talk to you later.
Thanks for listening to today's program. The Traders Network is a production of Yorba.tv LLC and is streamed live and archived at yorbamedia.com. We invite you to listen live, join in the conversation real time, and link to the Traders Network on the Yorba Media website. All opinions in this show are that of the presenters or their guests, and not of this station's owners or management. These opinions are for educational purposes only and should not be interpreted as investment or financial advice. All investments involve risk, and past performance is not indicative of future results. Tune into the Traders Network every Monday through Friday afternoon here on 1190 AM.